Good afternoon, everyone. Thank you for joining today's webinar, Remote Patient Monitoring in a Podiatric Practice. My name is Anana Onyaba, and I'm a Program Manager in the Center for Health Information Technology and Innovative Care Delivery at the Maryland Healthcare Commission. The MHCC is an independent regulatory agency whose mission is to, among other things, plan for health system needs and promote informed decision-making through a variety of initiatives. This includes promoting and diffusing health information technology, including telehealth, among healthcare providers. Additionally, the MHCC supports innovations in care delivery that focus on improving health outcomes and quality of care while reducing costs to the healthcare system. During today's webinar, I'll provide an overview of telehealth and the MHCC's role in telehealth and highlight available resources to facilitate telehealth implementation in your practice. You'll also learn about remote patient monitoring, or RPM, and tips for selecting vendors and technologies and getting reimbursed for RPM services. Before we get started, I'd like to cover a few housekeeping items. The webinar is being recorded and will be posted to MHCC's website. Continuing medical education credit will be provided by CME Online for this webinar. CME Online is approved by the Council on Podiatric Medical Education as the provider of continuing education in pediatric medicine. CME Online has approved this activity for a maximum of 1 continuing education contact hour. A certificate will be emailed to the email address used to register in approximately 2 weeks. At this time, all webinar participants are muted to limit any background noise during the presentation. We will have a 10-minute question and answer session following the presentation. Please enter your questions into the questions pane, and I will read these out loud to Dr. Birdie at the time of the question and answer session. So I'll kick off the presentation with a background on telehealth. Telehealth makes it possible for healthcare professionals to treat patients whenever and wherever needed and can be used to enhance care delivery. MHCC believes telehealth is an important strategy to improve access to care and reduce healthcare costs. As such, we work to assess the barriers to adoption and propose solutions, foster technology adoption and meaningful use through grants and other initiatives, and educate providers and consumers on value and best practices. A variety of telehealth technologies are available to help providers manage patient care and deliver services to meet patient needs. Some involve a direct connection to the patient, such as live video or remote patient monitoring. Live video uses audio-visual conferencing to connect the patient with the provider in real time, whereas remote patient monitoring uses technology devices to track patient health information over time. And I'll share a little bit more about this method in a moment. Store and forward is used to support care delivery. For example, in radiology, where a provider sends an image like an X-ray to a radiologist who reviews and sends their findings back to the provider. Mobile health is a subset of telehealth, and it's patient-driven. It involves use of devices like smartphones, tablets, and wearable devices. Remote patient monitoring enables patients to gather their own health information and share it securely with their providers. It's often used in patients' homes to remotely monitor their biometric data. Next, I'll highlight some RPM devices used in podiatry. RPM data can be collected by medical devices or through software interfaces installed on smartphones, tablets, or smartwatches, and then the data is transmitted to providers. Some examples of RPM podiatric devices include custom diabetic inserts with incorporated sensors that monitor or measure food temperature, pressure, and patient adherence, and adjustable boots that track patient activity and patient compliance for healing plantar wounds. Implementing RPM can improve patient engagement in their own healthcare. While many RPM programs aim to reduce hospitalizations in the short term, the technology is increasingly being used to facilitate care management and long-term health goals. Additionally, it can reduce complications, morbidity, hospital readmissions, and costs. MHCC provides technical support to practices that supports telehealth implementation, fosters peer learning about best practices, and builds awareness about the utility of telehealth among consumers. The Telehealth Virtual Resource Center, or TVRC, includes resources for providers and consumers, such as best practice tips and privacy and security considerations for remote patient monitoring, coverage and billing requirements for remote patient monitoring, a telehealth technology vendor portfolio that provides high-level information to help practices identify and review over 70 HIPAA-compliant telehealth vendors, and a telehealth readiness assessment tool for practices to determine their readiness for telehealth. You can find more resources by clicking on this link to the TVRC at the bottom of the slide. Next, I'll turn it over to Dr. Brody, who will provide information about remote patient monitoring in a podiatric practice.
Okay, very good. Welcome to today's presentation on utilizing remote monitoring to improve patient outcomes and improve the bottom line of your practice. We're going to be going over details of remote monitoring and the different types of remote monitoring that you can utilize to improve patient outcomes. Next slide, please. Okay. Disclaimer, which is necessary for all CME programs. I am a consultant for Digitsol, a company that manufactures devices that can be used for remote therapeutic monitoring. I will not be discussing Digitsol devices during this presentation. I also have business interests in TLD Systems, Registry Clearinghouse, and CME Online, none of which have any relationship to this presentation. I'm a consultant to PICA, the technical editor for Podiatry Management Magazine, a co-chair of the EHR work group at HL7, once again, none of which have any relationship to this presentation. Next slide, please. Now, and then already went over this, but just to review, remote patient monitoring is a method of healthcare delivery that allows us to utilize technology that has been developed, and it's relatively recent technology, to gather information on our patients outside of traditional healthcare settings, which means that we can get information about our patients and what's happening with their health when they're not physically in our office being examined. Next slide, please. Now, how does the ability to get this information help us to improve the care that we provide to our patients? It's important to realize that when a patient presents to our office for an examination, they are not in a real-world environment. They are aware that they are being examined. They are aware that they're being watched, and they may want to try to highlight certain conditions so that way we see things, or they may want to, shall we say, appear more normal, so therefore they try to hide some conditions. So what we see during the examination and what information we get to the patient is colored by the fact that the patient happens to be in a healthcare environment. I know that in my practice, many times when I ask a patient how they are, they say, I'm fine. I have to turn to them and say, you realize that when I'm asking that question, it is not a social question, because people will tend to say, how are you feeling today? I'm great. Well, if they're great, why are they in your office? So therefore, you have to think about, okay, how am I actually going to get valid clinical information from this patient? Because what they're saying may not be accurate considering their clinical presentation, and how they're presenting may not be accurate because they may have supratentorial effects that are basically hiding what is going on. Next slide, please. Now, when we talk about remote patient monitoring, there are two different types of remote patient monitoring that we can utilize and be reimbursed for. The first is remote therapeutic monitoring, and the second is remote physiologic monitoring. And these are two totally different concepts. As of January 1st of this year, remote therapeutic monitoring is reimbursable. Previously, we could get reimbursed for remote physiologic monitoring. And these two monitoring programs are for totally different purposes. They have different devices that are used, and they are reimbursed utilizing different CPT codes. Next slide, please. Now let's talk a little bit about remote physiologic monitoring. When we're talking about remote physiologic monitoring, we're monitoring some sort of physiologic value. So we have some examples on the screen, such as blood pressure, weight, pulse oximetry, respirations. We're able to get a specific value, a specific measurement for physiologic monitoring. Next slide, please. For physiologic monitoring, there are some specific requirements that have to be met in order for physiologic monitoring remotely to be reimbursable. The first and most important, as the device must be approved by the FDA as a physiologic monitoring device. In addition, remote physiologic monitoring is done in real time. The data is sent to us automatically. It does not require the patient to hit a button. It does not require the patient to have some sort of action. The monitoring device must be connected via Bluetooth or some other method to a transmitter that sends the data directly to the monitoring software without any patient acting. For remote physiologic monitoring, the data can be monitored by a podiatrist, a licensed healthcare professional, or other qualified healthcare professional who is under the supervision of the podiatrist. So therefore, you can have your clinical staff set up and perform remote patient monitoring for the patient as long as they are under your supervision. Next slide, please. Now, when we talk about remote physiologic monitoring, the first CPT code involved in this is 99453, which is the initial setup and patient education on use of the equipment. Now, one of the things to be aware of with this code is that it can only be billed once on initial setup. So if you set up a patient with a device for remote physiologic monitoring, and you've been monitoring them for a period of time, and the device happens to fail or wear out, and you have to replace the device, you cannot bill 99453 a second time. The patient only is being trained on the device once, and you can only get paid for setting it up once. So no matter how many times you have to replace the device, 99453 is only billable one time. The 99453 code also includes the first 16 days, at least a minimum, of remote monitoring in the calendar month. So if you happen to give a patient a remote monitoring device on the 20th of the month, you cannot bill 99453 until the next month, because if you give them the device on the 20th of the month, even in the longest month of the year, you can only have 11 days of remote physiologic monitoring. Therefore, in terms of reimbursement, you always want to give them the device in the first half of the month, so that way during the month you can get a minimum of 16 days of remote monitoring in order to bill 99453. Next slide, please. The next code that is involved with remote physiologic monitoring is the monthly monitoring code. So for each follow-up month after the first month, you can bill 99454. Now, if you look at the third item in on the second line, the code is for the supply and programming of the medical device. This code is known as a physician expense code. It reimburses you for the costs of doing the remote monitoring. There is no physician work involved in it. So basically 99454 covers any monthly fees you have associated with doing the remote monitoring and actually looking at the information to make sure that there's nothing going on that is actionable by you that requires an intervention. Once again, for 99454, 16 days must be monitored. You must have data for at least 16 days and review 16 days of data in order to bill 99454. Next slide, please. Now, as I mentioned earlier, these two codes are practice expense codes. They do not reimburse you for any time or work spent with the patient that you may need to do as a result of having values come to you that are out of sync with what you're expecting that require you to intervene. So therefore, this is automatic. Whether the patient has to come in or not, whether the patient is normal or abnormal, these codes are automatic and you get to bill them each and every month. Next slide, please. So when you first set up the patient for the device, because the codes that I told you are practice expense only and not physician work codes, it is reasonable to bill the appropriate E&M code on the day you set up the patient with the device. And since 99454 includes a monthly fee for the device, that means that any costs associated with the device on a monthly basis are your responsibility and not the patient's, because you're being reimbursed for those fees each and every month. Next slide, please. Now, just to reiterate, remote physiologic monitoring must consist of a minimum of 16 days worth of data in the 30-day, obviously February is 28 and some days have 31, but 16 days worth of data in the calendar month. And they can only be billed when you have actually reviewed a minimum of 16 days of data from the medical device. Next slide, please. Now, here's where we get to the physician work component of remote physiologic monitoring. If the data from the device indicates that some sort of communication with the patient is medically appropriate and some sort of intervention is medically appropriate, there are codes that can be billed for the time and effort you spend reviewing the data and interacting with the patient to address any issues as identified by the remote monitoring. Next slide, please. Now, this means that your interaction can be phone calls, text messages, some sort of interaction with the patient, because once again, at that point, you are doing physician work. And let's look at those codes. Next slide, please. The two codes that are involved when we have to interact with the patient as a result of remote physiologic monitoring are 99457 and 99458. 99457 is for the first 20 minutes or more of staff time in the calendar month that requires interactive communication with the patient during the month. If you go for 40 minutes, then you have a second code, 99458, which you have for each additional 20 minutes. So therefore, whenever you're dealing with remote physiologic monitoring, if the values result in you needing to intervene, it is important that you thoroughly document any time you spent looking at the data, preparing for the interaction with the patient, the time spent interacting with the patient, so that way at the end of the month, you're going to add up all of these minutes and determine, can I bill 99457? Can I bill 99458? And how many units of 99458 can I bill for the calendar month? Next slide, please. So here are some details in terms of calculating what you can bill and how often you can bill these codes. If you spend a total of 19 minutes of time with the data and with the patient, you cannot bill either of these codes because you have not hit the 20-minute threshold. If you spend any amount of time between 20 and 39 minutes, you have code 99457 because you have spent at least 20 minutes with the patient. If you spend 40 to 59 minutes, then you have 99457 for the first 20 minutes, 99458 for the second 20 minutes, but because you did not hit a full 320 minutes, you only have one unit of 99458. Going on 60 minutes gives you 1 unit of 99457 and 2 units of 99458, and I apologize for the typo here. And each additional full 20 minutes is another unit of 99458. Therefore, this is where you can add things up. Now, if a patient happens to come into the office for a visit in the office and you bill an E&M code for that visit, you cannot include that time or that visit in the time that you are counting towards 99457 and 99458 because you're billing an E&M for that. The 99457 and the 99458 are for the interactions that you have where you're not billing for an E&M code. If you happen to have a telehealth session and you bill for that telehealth session, then the time spent during that telehealth session cannot be used when adding up the total time for these codes. Next slide, please. So the time, once again, for the month is cumulative. So if you spend 5 minutes on Monday, 3 on Tuesday, 8 on Wednesday, and 10 on Friday, that means that in that week you spent 26 minutes for the week. And once again, you're going to add up all the time over the calendar month to bill these codes. Because you're going to be adding up the time, it is important that you have the number of minutes you spent with the patient documented in the patient's chart. So that way, if you happen to be audited by the payer at some point in time, your chart notes can justify your billing. Next slide, please. Now, you cannot double dip on the device bill. So let's just say that you have a remote physiologic device that you use to track a patient's weight, and you have another remote physiologic device that you use to track the temperature of the patient's feet. You have two devices attached to the patient, but 99454, the monthly remote monitoring fee, can only be billed once, no matter how many devices you are monitoring remotely. So you cannot double dip on 99454. No matter how many devices, this code is only billable once per month. Next slide, please. But if you happen to be monitoring multiple physiologic values, and you spend time interacting with the patient for these multiple physiologic values. So utilizing the examples I gave you before, if you interact with them because you want them to lose weight to address their heel pain and their weight is going up, or you're interacting with them also because you're monitoring the temperature of the feet and there's something going on, you can take the time you spent interacting with them about their weight and the time you spent interacting about the foot temperature and add them up cumulatively to determine what the number of 99457 and 99458 codes you can bill. So the remote monitoring, the physician work is cumulative, whereas the physician expense codes are not cumulative. Next slide, please. The next type of remote monitoring that we're going to talk about is called remote therapeutic monitoring, and it is different from remote physiologic monitoring. Just to review, remote physiologic monitoring is monitoring something that we can measure as a number such as weight, heart rate, respiration, etc. Remote therapeutic monitoring is monitoring the impact, therapeutic impact that our treatments are having on the patient. So if we were to monitor a patient's gait, if we were to monitor a patient's ulcer size, monitor the adherence to postoperative devices such as boots, monitor the adherence to a patient's taking medications, anything that we can do to monitor a patient's progress in a treatment plan would be considered remote therapeutic monitoring. And at this point, most of the devices that I have seen out there that fit well within the scope of practice of podiatry are more of remote therapeutic monitoring than remote physiologic monitoring. There's only so many devices out there that give us physiologic data about the lower extremity. Next slide, please. So let's look at the codes for remote therapeutic monitoring. And you'll see there are many parallels between remote therapeutic and remote physiologic monitoring. We have the setup and education code, which is 98975. Once again, this is for the one-time setup and for the patient education. And once again, this includes the first 16 days of monitoring. Then we have the monthly code of 98977, which is the monthly monitoring for devices that measure something related to the musculoskeletal system. Once again, this is each 30 days with a minimum of 16 days within the reporting period. If you look at the slide, you'll see in the middle, I have 98976, which is a remote therapeutic monitoring code for monitoring the respiratory system. It's there for completeness sake, but it's really not within the scope of podiatry. But I'm including this so that way you're aware the code exists. So that way, if you see it, you understand this is something that exists, but really does not fit within our scope of practice. Next slide, please. Now, 98977, once again, is the supplying the device to the patient. It's a physician expense code. It covers you for the cost of the device and the cost of setting up the device in the system. Next slide, please. 98975, 98976, and 98977 are practice expense codes. We discussed this, but I'm going to review it again. These are for remote therapeutic monitoring. These are the reimbursement codes for the device and the cost of the device and the cost of any monitoring software. Therefore, the same rules apply. It also means that when you're dispensing a device, it is appropriate that to bill an E&M code at the appropriate level based upon the visit. So you can bill an E&M code when you're billing one of these codes. Next slide, please. Now we're getting into the physician work codes for remote therapeutic monitoring. And they are very much like the codes for remote physiologic monitoring. The first code, 98980, is for your first full 20 minutes. 98981 is for each additional full 20 minutes. So once again, you have to have a full 20 minutes to bill each or any of these codes. Next slide, please. So, can remote therapeutic monitoring be used for non-physiologic data? And that is the exact purpose of remote therapeutic monitoring. We want to actually monitor things that are not necessarily physiologic data that will help us determine, is the patient benefiting from our treatment plan? Are they getting better? Are they getting worse? Do we need to modify our treatment plan? Is something going on with the patient that requires us to intervene so that way we can prevent a complication for this patient? Next slide, please. So remote physiologic monitoring is specifically for physiologic data. And that's the major difference between the two types of monitoring. It's important to realize that you can monitor a patient for remote physiologic monitoring and bill the monthly code for remote physiologic monitoring for a physiologic monitoring device at the same time that you are doing remote therapeutic monitoring and bill the monthly code for the remote therapeutic monitoring device. In addition, if you spend time interacting with the patient as a remote physiologic issue, you calculate that time separately from the remote therapeutic because the physician work is on two separate code sets. So you need to make sure if you're keeping your time on that, that you separate the two out if you're monitoring for both physiologic and therapeutic issues. Next slide, please. So what type of device can be used for remote therapeutic monitoring? Once again, if we're doing remote therapeutic monitoring, the device must meet the FDA's definition of a medical device and cannot be a consumer-grade device. That has to be a medical-grade device that has been identified and approved by the FDA for remote monitoring, whether it be therapeutic or physiologic. Next slide, please. So, in surveying what is out there and what I have seen that can be utilized for remote therapeutic monitoring, we can utilize remote therapeutic monitoring to monitor patients' gait, monitor patients' wounds, monitor adherence to post-operative home physical therapy, monitor adherence to offloading devices. These are what I've seen out there, but companies are constantly developing new remote monitoring devices that they are applying to the FDA for approval. So the ecosystem of things we can utilize is going to increase significantly over time. Please remember, these codes only became reimbursable just 3 months ago, and many companies are looking to create new devices that we can utilize for remote monitoring, and we'll be seeing them come to market over the next few months and years. Next slide, please. Now let's talk about the clinical value of monitoring gait. because I think this is very, very big and something that much of us can do. Patients who come into our office for foot pain are often going to walk in an altered manner. They're going to be antalgic, they're going to be guarding, and therefore the gait is going to be affected. So one question is the gait altered as a result of the foot pain, or is the altered gait the cause of the pain? But either way, when we see improvement in gait, we know that we are addressing the issue because the pain is decreasing. Musculoskeletal imbalances can cause altered gait that can result in foot pain. And this is where we can do gait monitoring because once again, that code that we saw, the second code, is for things in the musculoskeletal system. So by monitoring the gait, we are monitoring a musculoskeletal issue. As I said, guarding in foot can cause altered gait, and understanding the nature of a patient's altered gait may help to inform us as to what we can do and what treatment plans we can have to get the patients walking better and less pain-free and functioning better. Next slide, please. To that end, prior to dispensing any device that monitors gait, it's important that you do a complete biomechanical and gait evaluation in your office to get a baseline, so that way you can see what is going on and you see if the gait is improving as a result of the therapy that you are providing the patient. Next slide, please. Now, this is true for anything, but we're going to continue with gait. We'll get on to other things in a bit. Once you begin your treatment plan, you're going to want to see an improvement in the patient's gait. There's going to be greater symmetry in gait between the left and the right side, increased stride length, a better cadence. These are all things that could be monitored remotely over time. And these improvements in these aspects can demonstrate improved patient function, which is a valuable piece of information. And once again, as more devices come to market, there may be more things that we can look at and monitor when we're monitoring a patient's gait. Next slide, please. Now, it's important when we talk about these patients that sometimes pain is absent. Sometimes pain can be absent because a patient is neuropathic. Sometimes pain can be absent because a patient is guarding and therefore not walking on the part of the foot that is causing them pain. So very often we'll say we monitor their pain scale to see how they're improving. But if they are walking in such a way that they are not walking on the painful spot, it may not really hurt, but they're walking in an altered manner. So this gives us another gauge as to how our treatment plans are working, because once again, we can't always trust a pain scale. Next slide, please. Now, we can also monitor use of offloading devices or use of devices that are part of a physical therapy system. So if you have a device placed in a patient's Crow boot, cam walker, or some other offloading device, and the monitoring tells you how many hours per day the patient is walking in the device, this can give you a very good idea of the patient's adherence to the treatment plan. Because I'm sure we've all run into patients who we're telling to do something or telling to wear an offloading device. And the day they come into our office, they're wearing the device and they say they're wearing it all the time, but somehow they're not really healing. I found out about this a number of times because patients, friends, family members, or neighbors have tattled on the patient, called me and said, I know they're supposed to be wearing this, but they're always around town doing things and they're not wearing it. And I know they should be, and I thought you should know. This gives you real-time feedback as to whether or not the patients are utilizing the devices that you have prescribed because they are medically necessary to treat their problem. Because patients don't want to admit to you that they're not being adherent. Therefore, they may come in wearing that offloader in your office and not necessarily being fully transparent with you about their level of use of the device. Next slide, please. So the clinical value of monitoring adherence is if you know the patient is using it or not using it, and the patient is not getting better, it can inform you as to what steps to take, whether to maybe have a conversation with the patient about adherence, or maybe they are actually using it and it's not getting better and you need to maybe reevaluate the method of offloading you're using, or look to see if there are other underlying issues that even with offloading the patient is not healing. So it can help you to make better clinical decisions. It can help you with better communication with your patient, and as a result, it can help to improve the outcomes on your patients utilizing these devices. Next slide, please. We also can monitor wounds. Now, clinical therapeutic monitoring of the wound can involve the patient sending a daily digital image to the clinician, so that way we see how the wound is doing. And by looking at this wound each and every day, we can detect changes in the wound that indicate that something is happening that is going south, that the patient is developing complications. How many times has a patient walked in with who you've been treating for a wound, who you say come back in 2 weeks, and they come back 2 weeks later and it's worse? It's like, when did it start getting worse? Oh, a couple of days after I saw you. Well, why didn't you come in? Well, I knew I had an appointment in 10 days, so I was going to wait till the 10 days. But if they'd come in as soon as things started going south, you could have addressed it and prevented a fair amount of morbidity and a fair amount of complications, and helped to make sure that the patient's treatment plan ends up with the best possible outcome. So monitoring wounds on a daily basis can help you to improve their outcomes. Next slide, please. Now, it's also very important when we use remote physiologic monitoring or remote therapeutic monitoring that we use it appropriately. Not every patient is necessarily a candidate for remote monitoring, and we should not be placing remote monitoring on each and every patient simply because we can be reimbursed for it. So when we indicate a patient for remote monitoring, in our chart notes, when we indicate the patient, we have to document the medical necessity of the remote monitoring and what the goals are and what the purpose is, because we do not want to start doing things that are medically not necessary simply because we can be reimbursed for it. Next slide, please. Once again, I said this before, but when monitoring gait, we're going to start with the biomechanical evaluation, and this gives us the information that indicates that the monitoring gait remotely is medically necessary. It's important to realize that if you provide services that are not medically necessary, it is not ethical, and it could potentially be considered fraud, waste, and abuse by the insurance companies, and it is a crime under a number of different statutes. So please make sure that you only utilize these services when there is a good medical reason to do so, and when you feel it's going to be able to allow you to improve the care that you provide to your patients. Next slide, please. Now, when might remote therapeutic monitoring of gait be necessary? Well, preoperatively to understand a patient's gait prior to surgical intervention, postoperatively to understand how the surgical procedure has altered the patient's gait. You might want to do the remote monitoring prior to providing orthotics, whether they be custom or over the counter, to see if the devices are improving the patient's gait and to what degree, so that way you can determine, are they working? Do I need to modify these devices? So therefore, you can utilize them to monitor the patient's progress. You can also utilize remote therapeutic monitoring when you have a patient with a gait or biomechanical disturbance, and you're going to be using physical therapy or other modalities to try to improve their gait. You can also utilize remote patient monitoring of gait with patients who are at risk of falls. As far as remote monitoring of patients who happen to have ulcers, who are using offloading devices, or you're actually taking pictures of the ulcers, that's much more straightforward than gait. Next slide, please. So when we talk about being much more straightforward than gait, it's very simple. A wound must be present. And therefore, what about monitoring for patients at risk of wounds? Is that reasonable? It could be. In fact, there's actually some physiologic monitoring devices that alert us when a patient is having physiologic values that put them at greater risk of developing a wound. And that might be a device that measures the temperature of the foot and looks for temperature changes in the skin, a device that measures pressure and looks for pressure changes under the foot. So therefore, you can monitor a patient who's at risk of wounds, as long as they have a history of wounds and they have risk factors. You can monitor a patient who has wounds to watch to see if they get better. So this is something that is also reasonable, both from the perspective of remote therapeutic and remote physiologic monitoring. Next slide, please. So let's look at reimbursement. What are you going to get paid for providing these services in your office? Next slide, please. The first code is 99453, which is remote physiologic monitoring. This is the one-time fee for setting up the device and programming it and educating the patient. It is not a great fee. It's approximately 16.72, but you can bill the E&M code that's appropriate at the time you bill 99453. Next slide, please. 99454 is the remote physiologic monitoring monthly code. Once again, similar to 99453, this requires 16 days of monitoring data and covers the cost of the device and any software that's involved with you monitoring the device. And once again, for 99454, it does not require that you interact with the patient. Next slide, please. 99457, this is the first physician work code. This is your first 20 minutes, and it's approximately $47. So if you need to interact with the patient for at least 20 minutes over the course of the month via telephone, web meeting, whatever, and using the data, you're going to get 99457, which is not a terrible monthly fee for actually interacting with the patient. Next slide, please. 99458 is for each additional 20 minutes you have to review data and interact with the patient, and it's about $38. Next slide, please. 98975 is the remote therapeutic monitoring code for dispensing the device. It's about $17, once again a one-time fee, but once again you can bill an E&M code at the time of dispensing the device. Next slide, please. 98976. This one, once again, this is the respiratory monitoring code, which we will not be using. Next slide, please. 98977 is the musculoskeletal monitoring code, which does fall into our scope of practice. And this one is a monthly fee of almost $49, simply to cover the costs of the device and any software and tools you use to receive the remote monitoring data. Next slide, please. 98980 is your first 20 minutes of data analysis and interacting with the patient when it requires you to interact with the patient. And you can see this is approximately $47. Next slide, please. 98981 is each additional 20 minutes. And once again, this is a little bit over $38 for each additional 20 minutes. I want to once again reiterate, please, when you're billing these codes, have the amount of time you spend reviewing the data, preparing for the patient interaction, and interacting with the patient documented in your chart. So that way, should you be audited, your chart notes will support your billing. Next slide, please. So, some important details. You can bill a patient concurrently for remote therapeutic monitoring and remote physiologic monitoring, but you can only bill one expense code for a remote therapeutic monitoring and one remote physiologic monitoring, no matter how many devices a patient may have on. You can only bill these codes, the monthly physician expense codes, once per month for each type of monitoring. There is no limit on the number of minutes you can spend interacting with a patient related to remote therapeutic or remote physiologic monitoring. But once again, any time you spend that is billable as an E&M code or a telehealth code, that time cannot be included in the time that you add up for your interaction for remote monitoring of the patient. Next slide, please. So what does remote therapeutic monitoring mean to your practice? It means that you can have additional tools to monitor patients' outcomes, monitor patients in the real, get a sense of what's happening to that patient when they're not physically in your office. Because they come in, we may see them for 5 to 15 minutes once every couple of weeks. And then they've got a full 14 days at 24 hours a day where they're not in our office. They're out there in the real world exposing themselves to potential risks, and either being adherent or non-adherent to their treatment plans. This gives us a window into the patient's real world, so that will inform our treatment plans. So that way we can end up with better outcomes for our patients. Next slide, please. Remote physiologic monitoring, similar. Once again, in this case, we are monitoring physiologic values, but once again, it provides value to us in knowing what's happening with the patient in the real world. So that way we can be better doctors and help our patients to get better. These codes related to remote physiologic monitoring and remote therapeutic monitoring, at least in my opinion, are steps in the direction of us getting paid to keep our patients well, to keep our patients healthy, as opposed to being paid for treating them when they're sick. We have ways now of actually being reimbursed for being good doctors and making sure that our patients don't get sick, that they don't develop complications, and they don't end up with situations that are going to cause significant morbidity. Next slide, please. So in terms of your practice, who might be eligible for remote monitoring? How many patients are pre-op? How many are post-op? How many are using orthotics? How many have a biomechanical or gait disturbance? How many are at risk of falls? Multiply that by approximately 50, and this is your potential monthly additional income, less the cost to you for the remote monitoring services. Next slide, please. So think about it. How many of you have told patients to lose weight to help with their podiatric pathology? These people might be eligible for remote physiologic monitoring. What other physiologic values are valid? We've talked about a couple already: foot pressure, foot temperature. And once again, someone who you might want to monitor these things on, you can then do remote monitoring and reimbursed at the rate of $49 a month. And then you have that coming into your office, less the cost, which provides you with additional income. And once again, if you spend any time interacting with the patient, because the information coming to you from remote monitoring indicates interactions are necessary, you can be paid for that time. In addition, you may tell the patient to come into the office because you need to examine them in person. That gives you more office visits, more potential E&Ms, which allows you to, once again, face-to-face interact with the patient, deal with the situation, deal with it early on, so that way it's not as big a problem for the patient, and be reimbursed for your time and effort. Next slide, please. So for podiatry, remote therapeutic monitoring, as I said, for the most part fits better into most of our practice patterns, because monitoring their glucose, their respiration, their heart rate, etc., most of the remote physiologic monitoring things are outside our scope. But as I said, there are 3 items that I'm aware of today that fit within the scope of podiatry: a patient's weight, the skin temperature of the patient, and the pressure on the plantar foot. And there are remote monitoring devices that fit in for each of those 3 items. Next slide, please. But please remember, we want to make sure that we're only doing remote monitoring when it is medically appropriate, because we don't want to find that we as a profession start abusing the codes. We don't want to see that people are going to be quoted for fraud, waste, and abuse for overutilizing these when it's not medically necessary. So when the patient has achieved their treatment goal, we may need to, shall we say, back off on the remote monitoring on that patient because it's no longer medically necessary. So always think about medical necessity when you start and as you're continuing remote monitoring, whether it be physiologic or therapeutic. Next slide, please. Okay, so now we come to the time for questions, and we have approximately 10 minutes left in the hour. So on your control panel, there is an arrow. Clicking on that arrow opens and closes the control panel. Within the control panel is an area where you can type in your questions. Please type in any questions and we'll answer as many as we can in the time we have left in today's webinar.
Thank you so much, Dr. Brody, for that very informative presentation. I have a couple of questions for you. So question 1, can I bill a patient for remote therapeutic and remote physiologic monitoring?
You absolutely can do both remote therapeutic and remote physiologic monitoring concurrently. And you can do that, for example, looking at patients' the temperature of their feet at one point for a physiologic, and you can look at them in terms of monitoring their use of an offloading device for therapeutic. And you can do them concurrently and bill for them under the two separate sets of codes.
Thank you. And I have an additional question. Do private insurers pay for remote patient monitoring?
Okay, we do know based upon the articles that have been published by CMS that Medicare will pay for remote patient monitoring. Each private insurer has to come up with their own policies and procedures on what is covered and what is not. And I'd recommend that you reach out to the insurer and ask them, do they cover, and give them the codes that are utilized for remote monitoring to find out what they cover, if they cover it, and under what conditions and situations they will be covered, because they may be covered only for certain diagnoses. So before you put a patient on a remote monitoring solution, you want to find out if it's covered or if the patient is going to have to pay you out of pocket. And once again, keep the patient very informed if they're going to be paying out of pocket, because that's a major issue with the surprise billing law, which took effect recently.
Thank you, Dr. Birdie. So how much does remote patient monitoring cost me as a provider?
Okay, remote patient monitoring, there may be a monthly fee to you for access to the data, because each of these solutions is a device that goes in the patient's home and then transmits the data to a centralized hub, where then the company that actually manufactured the device then shares the data with you. Typically, these companies will charge you a monthly subscription fee for access to the data and connect to it. And you want to find out what those are, because you want to make sure that if the monthly fee for it is $48.37, that you're not paying $50 a month to receive the data, and therefore monitoring the patient remotely costs you money. You want to make sure that that doesn't work that way, and you want to talk to any vendor and make sure that any system that they are going to sell you with the data allows you to be reimbursed for your time and effort and not cost you money.
Thank you, Dr. Birdie. And then this question is from Dr. Nelson. It says, can you interact with patients in a group setting and bill individually?
I do not know. That is really a question for a billing and coding expert. I don't see a reason why not, because you can't bill one patient for what you do for the other. But once again, I would defer that to a billing and coding specialist. I am not a billing and coding specialist.
Thank you. And then an additional question for you, Dr. Birdie. Can I have my staff do the remote monitoring?
You can have your staff do the remote physiologic monitoring, but because of the way the remote therapeutic monitoring rules and regulations are written, the licensed podiatrist must do the remote therapeutic monitoring, because at that point you are monitoring a medical condition as opposed to simply data. So you cannot delegate that to one of your staff members. The remote physiologic monitoring you can delegate. The remote therapeutic monitoring you cannot.
All right. Thank you for that, Dr. Birdie. And this is the last question I have, unless a couple more questions come in to the chat box while we're speaking. The question is, how is remote patient monitoring different from telehealth?
Okay, remote monitoring is a device sending data to you that you're going to look at either on a piece of paper or on the computer screen, where you're not interacting with the patient. You're just looking at, for example, think of it as a lab report. So if you send a patient for a lab report and you get the report back, that's data coming to you. But when that data is coming in real time from the device, that's remote patient monitoring. Telehealth is when you get onto, for example, a Zoom call with a patient and you talk to them and you interact with them, and you may have them put their foot up to a screen. That is telehealth. And when you're doing telehealth services, you are billing under the telehealth codes. And that's so you may end up, as a result of the remote monitoring, engaging the patient in a telehealth session or engaging the patient in a live in-person visit. So remote patient monitoring can lead to telehealth, but they are different. And if the remote patient monitoring leads to telehealth, then the time that you spend speaking to the patient during that telehealth session does not count in the time you add up for the remote patient monitoring codes.
Thank you, Dr. Brody. And I'll just pause for a few minutes to give people additional time to enter any additional questions into the questions pane. And as Dr. Brody mentioned earlier, if you want to ask a question, just go under the questions pane and type in your question. And we'll just pause for a moment. All right, it does not look like we have any additional questions. Dr. Brady, did you see any additional question come through?
I do not see any additional questions.
All right. Well, thank you all for joining today's webinar. As mentioned earlier, the slides from today's session and the recording will be sent to participants and also posted on the MHCC's website. Additionally, CME credit will be provided within 2 weeks of this webinar to the email address used to register for this event. Thank you all and have a great afternoon.